Do you also find trigeminal nerve the most difficult nerve? और कितना भी याद कर लो एक ना एक ब्रांच तो जरूर छूट जाती है. Wait, then this video is just perfect for you, as in this video I will be sharing my favorite mnemonics and my way of studying it, and I really hope that it is helpful. Described about the clinical anatomy, that is really very helpful when you are giving the nerve blocks, so make sure to watch this video till the end. Trigeminal nerve, as the name indicates, it will have three branches, that is tri and geminal. Now, this is the fifth cranial nerve and this is the largest cranial nerve. Now, the ganglions that are supplied by this nerve are ciliary, pterygopalatine, otic, and submandibular. Basically, it is related to the frontal region, maxillary, and mandibular region. So, all the ganglions are related to that such as ciliary, pterygopalatine, then mandible is also supplied by this. Now, this nerve basically has two main parts. One is the sensory part and one is the motor part. Motor output is through the facial nerve. Now, the branches which are very important and very frequently asked in the viva as well as in the exams, that is branches of trigeminal nerve. It has three branches: ophthalmic, maxillary, and mandibular. Mandibular branch has both sensory and motor branches, whereas rest two are sensory branches only. Now, let's learn about the first branch, that is the ophthalmic nerve. You can remember the names of the branches by a mnemonic funnel, from which we have taken F, N, and L, which are the main branches. First one is the frontal, second is the nasociliary, and third is the lacrimal. Now, the frontal supplies to the frontal area, that is supraorbital and the supratrochlear. These are basically the branches. And the nasociliary supplies the nose and the ciliary ganglion as well. Lacrimal is the easiest because it just supplies to the lacrimal gland. Now, nasociliary की जो branches हैं उसके लिए I have used the mnemonic of Kapil, CAPIL, that is ciliary ganglion, anterior ethmoidal, posterior ethmoidal, infratrochlear. Supratrochlear is a branch of the frontal, whereas infratrochlear is a branch of the nasociliary nerve, and the long ciliary branch. Basically, as I mentioned in the first slide of this video, that it basically supplies to the ciliary ganglion and the otic ganglion. So you can remember the whole nerve using those ganglions. Now, ciliary ganglion is sensory to the eye. Anterior ethmoidal supplies to the sphenoidal air sinuses, and the posterior ethmoidal, इसमें उल्टा है, anterior सप्लाई करेगी posterior को और posterior सप्लाई करेगी anterior and middle ethmoidal sinuses को. Medial internal nasal as well as the lateral internal nasal. Medial और lateral दोनों nasals इसमें आ गए, as well as the external nasal. Now, the long ciliary supplies to the eyeball. Ciliary is sensory to the eye, long ciliary is supplying to the eyeball and infratrochlear. Now, the second nerve, that is the maxillary nerve. It is important for the nerve blocks. The mnemonics is MPIF. It supplies to the area of the maxilla, zygomatic arch, and the maxillary teeth. Now, this is important aspect for dentistry. Now, MPIF, middle cranial fossa, pterygopalatine fossa, infraorbital canal, and face. Medial cranial fossa से एक ही branch निकलती है, that is the meningeal branch. You can remember it as MM. Pterygopalatine fossa से दो branches निकलेंगे, ganglionic as well as the zygomatic branches. Zygomatico-temporal, temporal region को जो supply करते हैं, zygomatic-facial. Both of them are the sensory branches. Now, infraorbital canal से जो निकलती हैं, that is important. Anterior superior alveolar nerve, middle superior alveolar nerve, and face पे जो supply कर रही है, that is palpebral, labial, and nasal. These are very easy to remember. Now, the most important aspect is that the maxillary anteriors and premolars are supplied by the anterior and the middle superior alveolar nerve, except the mesiobuccal root, which is supplied by the posterior superior alveolar nerve. This is very important. So, if you have to anesthetize the first molar, you also have to give consideration to middle superior as well as the posterior superior alveolar nerve block. Now we have the mandibular branch, that is the last branch of this nerve. which supplies the mandibular teeth, tongue, and muscles of mastication. Now it is divided into three branches. One is the trunk, one through the anterior division, and one through the posterior division. Through the trunk, again that is meningeal branch, as well as the medial pterygoid nerve. Sorry, medial pterygoid muscle. अब ये दोनों आगे भी supply करते हैं, but these are relatively less important for us. Now anterior division से आप याद रख सकते हो mesobuccal और distal root, that is mesenteric, buccal, deep temporal and lateral pterygoid. Basically all the muscles of mastication. And posterior division की important है क्योंकि auricular temporal nerve निकलेगी, lingual nerve निकलेगी जो कि हमारी टंग को सप्लाई करेगी, and inferior alveolar nerve निकलेगी which is a whole nerve which supplies to the mandibular teeth and very important to anesthetize. And the nerve block video is already up, so you can definitely check that out. Now this is the diagram for the mandibular nerve, which has buccal nerve, lingual nerve, submandibular ganglion, sublingual gland से भी pass out होती है, and inferior alveolar canal which supplies the mandibular teeth, which I have tried to depict about the anterior superior alveolar nerve supplying to the anteriors, middle superior supplying to the premolars, as well as the mesiobuccal root. Talking about the clinical anatomy, in case of any injury to maxillary nerve अगर आपको लगता है तो there will be loss of sneeze reflex because the efferent pathways through the maxillary nerve. Injury to the mandibular nerve, you can see the loss of jaw reflex, flaccid paralysis of muscles of mastication because that is very important, partial loss of low pitched sound, trigeminal neuralgia, again very important, frequently asked, as well as clinically it is also very important, which will lead to the severe pain along the distribution of the maxillary and mandibular nerve. Then we have trigeminal ganglion, which can be the harbor of herpes virus, and it can get activated and affect along the distribution of the nerve. So I really hope that this video was helpful, and if it was, the notes that I have used in the video are curated by me, and if you want the PDF, I have already linked it down in the description box, so you can definitely download it from there and study. For more such educational tips and videos on dentistry, don't forget to subscribe to my channel.